Hey guys, okay, so we are in our final chapter of the book, chapter 23. Now, this is an important chapter and it's a big chapter with a lot that we need to cover. So, I'm going to do a part one and part two videos. And like with all the other chapters, it is your responsibility to read the chapter. You need to make sure that not only do you read this chapter completely, you look at all the figures, the case studies, the procedures in this chapter, and the medical terminology. But this chapter I will also be going over in lecture next week um, as well. So just remember this one's going to have two parts, but I'm going to hit on the big stuff. Okay. Introduction to Emergency Medical Procedures. Page 793. Medical emergencies often arise inside and outside of the workplace that can result in a sudden loss of life or permanent disability. If an emergency situation occurs in the medical office, the provider administers immediate medical care for the patient. Some medical offices maintain a crash cart for this purpose. In these situations, the medical assistant may be required to assist the provider in providing emergency medical care. The medical assistant may need to administer first aid for the medical emergencies that occur outside of the medical office environment. Please highlight the following. First aid is defined as the immediate care administered before complete medical care can be obtained to an individual who is injured or suddenly becomes ill. The medical assistant is most likely to administer first aid to a family member or friend. The purposes of the first aid are to save a life, reduce pain and suffering, prevent further injury, reduce the incidence of permanent disability, and increase the opportunity for an early recovery. This chapter focuses on common emergency situations that a medical assistant may encounter and the first aid required for each. It is not intended, however, as a substitute for thorough first aid instructions through the American Red Cross, the National Safety Council, or American Heart Association. Okay. Office crash cart. Please highlight the following. A crash cart is a specially equipped cart for holding and transporting medications, equipment, and supplies needed to perform life-saving procedures in an emergency. A growing number of providers are incorporating crash carts into their medical offices. Patients who are injured or suddenly become ill might be brought to a medical office for emergency medical care. In addition, the patient might develop a sudden illness at the medical office that requires emergency medical care. Examples of these situations include life-threatening cardiac dysrhythmias, shock, cardiac arrest, poisoning, or traumatic injury. The items on a crash cart vary widely among medical offices depending on the extent of the emergency medical care that is likely to be administered. This is directly related to the time it takes for emergency medical personnel to arrive and the location of the nearest hospital. Table 23.1 is a general list of medications, equipment, and supplies that may be included on an office crash cart. The medical assistant may be responsible for regularly checking the crash cart to replenish supplies and to check the expiration dates on medications. Emergency Medical Services System. Highlight the following. The Emergency Medical Services EMS system is a network of community resources, equipment, and emergency medical technicians, EMTs, that provides emergency care to victims of injury or sudden illness. An EMT is a professional provider of pre-hospital emergency care, which includes care at the scene and during transportation to the hospital. Highlight that an EMT Basic, EMTB, has received formal training and is certified to provide basic life support measures. An EMT Paramedic, EMTP, is qualified to provide advanced life support care, including advanced airway maintenance, starting intravenous drips, administration of medication, cardiac monitoring and interpretation, and cardiac defibrillation. Activating EMS is often the most important step in an emergency. Rapid arrival of EMTs increases the patient's chances of surviving a life-threatening emergency. In most urban and in some rural areas in the United States, the medical assistant can activate the local EMS by entering 911 on the telephone keypad. When calling local EMS, the medical assistant speaks, please highlight the following, with an emergency medical dispatcher, an EMD. Highlight an EMD has a formal training in handling emergency situations over the phone. The responsibility of an EMD is to answer the emergency call, listen to the caller, obtain critical information, determine what help is needed, and send the appropriate personnel and equipment. The EMD also is responsible for relaying instructions to the caller about providing emergency care until the EMTs arrive. These guidelines should be followed when calling EMS. Speak clearly and calmly to the EMD. Identify the problem as accurately and concisely as possible so that proper equipment and personnel can be sent. The EMD needs to know the number of victims, the condition of the victim or victims, and the emergency care that has already been administered. The EMD will ask you for your phone number and address. In responding, relay to the dispatcher the exact location of the victim, including the correct street name and house number, and if applicable, the building name, the floor and room number. With the 911 Enhanced Emergency System, the address automatically appears on the monitor. However, there is a chance that the address will not show up on the monitor. In addition, the emergency may not be happening in the same location as the caller. If possible, have someone meet the ambulance personnel and direct them to the scene. Do not hang up until the EMD gives you permission to do so. The dispatcher may need additional information or may give you instruction on treating the patient until EMTs arrive. So on this one, on table 23.1 on page 794 and 795, I want you guys to make sure that you read this over. It goes over medications named used in cardiovascular emergencies, intravenous solutions, medication used in breathing emergencies, anaphylactic reactions used for poisoning, neurologic emergencies, metabolic emergencies, equipment, things like that. It's just very, very, very good to read and study over. Also, take a look on page 797, a picture figures 23.1, which is your first aid kit. These are items that, if possible, is good to have at home in a first aid kit or in your car. But these are the items that you should expect to see in your medical office first aid kit. So under the first aid kit, the medical assistant should acquire and maintain a first aid kit. A first aid kit contains basic supplies to provide emergency care to individuals who have been injured or become suddenly ill. It is recommended that a first aid kit be kept at home and in the car. First aid kits are available at most drugstores. It is also possible to make your own. Along with items shown in figure 23.1, the first aid kit should include the phone numbers of the local emergency medical services, the Poison Control Center, and the police and fire departments. It is important to check the first aid kit regularly and replace supplies as needed, just like you would do in your workplace when you get in the medical field. Between first aid kits, it's going to go along with OSHA and CLIA. There are guidelines. You have to check every medication, every supply that's in your office for expiration dates, things like that. You would also want to make sure you do your first aid kits. OSHA safety precaution. Please make sure that you review the OSHA safety precautions 1 through 10. And then on page 797 for guidelines for providing emergency care. With this one, make sure that you read 1 through 9, but I want you to highlight this on 3. Before administering emergency care to a conscious patient, you must first have permission or consent. Okay, so now let's go over to respiratory distress. On respiratory distress, I want you to highlight the following. Respiratory distress indicates that the patient is breathing but is having great difficulty in doing so. For asthma, asthma is a condition characterized by wheezing, coughing, and dyspnea. During an asthmatic attack, the bronchioles constrict and become clogged with mucus, which accounts for many of the symptoms of asthma. And if this sounds familiar, it's because it should. We have already reviewed what asthma does and what with an asthmatic attack, what a patient will experience. Okay, so on page 798 with emphysema. Emphysema is a progressive lung disorder in which the terminal bronchioles that lead into the alveoli become plugged with mucus. That needs to be highlighted. Because of this problem, the alveoli become damaged, resulting in less surface area to diffuse oxygen into the blood. Highlight, eventually this condition results in loss of elasticity of the alveoli, causing inhaled air to become trapped in the lungs. This makes breathing difficulty, particularly during exhalation. Emphysema usually develops over many years and is found most frequently in heavy smokers. It also occurs in patients with chronic bronchitis and elderly patients whose lungs have lost their natural elasticity. Chronic emphysema is one of the major causes of death in the United States. As the lungs progressively become less efficient, breathing becomes more and more difficult. Patients with advanced cases may go into respiratory or cardiac arrest. Hyperventilation. Hyperventilation literally means overbreathing. Hyperventilation is a manner of breathing in which the respirations become rapid and deep, causing an individual to exhale too much carbon dioxide. Low carbon dioxide levels in the body account for many of the symptoms of hyperventilation. Hyperventilation is often the result of fear or anxiety and is more likely to occur in individuals who are tense and nervous. It is also caused by serious organic conditions such as diabetes coma, pneumonia, pulmonary edema, pulmonary embolism, head injury, high fever, and aspirin poisoning. Highlight the following. In addition to rapid and deep respirations, the signs and symptoms of hyperventilation include dizziness, faintness, and lightheadedness, visual disturbance, chest pain, tachycardia, palpitations, fullness in the throat, numbness and tingling of the fingers, toes, and the areas around the mouth. Now let's look at heart attack. Highlight the following. A heart attack, also known as a myocardial infarction, an MI, is caused by partial or complete obstruction of one or both of the coronary arteries or their branches. In most cases, the severity of attack depends on the size of the obstructed artery and the amount of myocardial tissue nourished by that artery. If a small branch of a coronary artery is obstructed, myocardial damage and symptoms may be mild, whereas the damage is usually extensive and the symptoms intense if the coronary artery is completely blocked. Highlight the following. The principal symptom of a heart attack is chest pain or discomfort. Patient describe the chest pain as squeezing or crushing pressure, severe indigestion or burning, heaviness or aching. Also highlight later in that paragraph, other signs and symptoms of a heart attack include shortness of breath, profuse perspiration, nausea, and fainting. For a stroke. Highlight that a stroke, also called a cerebrovascular accident, CVA, results when an artery to the brain is blocked or ruptures, causing an interruption of blood flow to the brain. Highlight the following. The signs and symptoms of a stroke include sudden weakness or numbness of the face, arm, or leg on one side of the body, difficulty in speaking, dimmed vision or loss of vision in one eye, double vision, dizziness, confusion, severe headache, and loss of conscience. Now let's go to page 799 for shock. Highlight the following. For the body to function properly, adequate blood flow must be maintained to all of the vital organs. This is accomplished by three important cardiovascular functions as follows. Adequate pumping action of the heart, sufficient blood circulating in the blood vessels, blood vessels being able to respond to blood flow. Those three things need to be highlighted. When an individual experiences a severe injury or illness, one or more of these cardiovascular functions may be affected, which can lead to shock. Highlight the following. Shock is defined as the failure of a cardiovascular system to deliver enough blood to all of the body's vital organs. Remember these four letters. FAST, F-A-S-T. Face drooping, arm weakness, speech deferment, and time to call 911. Please make sure that you write that down and you memorize that. Now let's go to hypovolemic shock. Hypovolemic shock is caused by the loss of blood or other bodily fluids. Then we have cardiogenic shock. Highlight that cardiogenic shock is caused by the failure of the heart to pump blood adequately to all of the body's vital organs. Highlight that cardiogenic shock is most frequently seen with myocardial infarction. Neurogenic shock. Highlight that neurogenic shock occurs when the nervous system is unable to control the diameter of the blood vessels. In the next paragraph, highlight that this type of shock is most often seen with brain and spinal injuries. The blood vessels become dilated and not enough blood is present in the circulatory system to fill the dilated vessels, which causes, highlight, blood pressure to drop significantly. Anaphylactic shock. Highlight that anaphylactic shock is a life-threatening reaction of the body to a substance to which an individual is highly allergic. 2 paragraphs down, I want you to highlight where it says the emergency care for anaphylactic shock is administration of epinephrine. Psychogenic shock. Highlight the following. Psychogenic shock is the least serious type of shock. It is caused by an unpleasant physical or emotional stimuli, such as a pain, fight, fright, and the sight of blood. Now let's go on over to page 800. Please become familiar with figure 23.2, 23.3, and 23.4. And then we're going to go over bleeding and external bleeding and nosebleeds from page 800, 801, 802, and then we're going to go to part 2. So for bleeding, you need to highlight that bleeding or hemorrhaging is the escape of blood from a severed blood vessel. For external bleeding, please highlight the following. Capillary bleeding. Highlight slow oozing of bright red blood. This type of bleeding occurs with minor cuts, scratches, and abrasions. Venous bleeding. Venous bleeding occurs when the vein has been punctured or severed. This type of bleeding is characterized by a slow and steady flow of dark red blood. Arterial bleeding. Arterial bleeding, the most serious type of external bleeding, occurs, highlight, when an artery is punctured or severed. It is the least common type of bleeding because arteries are situated deeper in the body and are protected by bone. Arterial bleeding is characterized, highlight, by bright red blood that spurts. On page 801, emergency care for external bleeding. Highlight the most effective way to control bleeding is to apply direct pressure to the bleeding site. Also highlight that the pressure functions by slowing down or stopping the flow of blood. In the next paragraph, I need you to highlight where it says if bleeding cannot be controlled with direct pressure, a pressure point can be used. Highlight a pressure point is a site on the body where an artery lies close to the surface of the skin and can be compressed against an underlying bone. Nosebleeds. Highlight that a nosebleed or epistaxis is a common form of external bleeding that usually is not serious but is more of a nuisance. Please become familiar with figure 23.5. Now page 802, also become familiar with figure 23.6 and 23.7. And then for emergency care for a nosebleed, highlight on 1, position the patient in a sitting position with the head tilted forward. And number 2, apply direct pressure by pinching the nostrils together.